now the panel is open for the question and answers. There is one question from the Dr. Pooja, I think, for Dr. Devamalar. I think the question is, in general, is it better to advise patients to plan aerobics first and then resistance to prevent hypos?
Okay, thank you so much for the question, Pooja. Now, generally speaking, if you want to prevent hypos, it's a good idea to do resistance training first and then followed by aerobic training, because resistance training will generally cause a period of hyperglycemia. So if you perform that followed by aerobic training, then it will help to mitigate the hypoglycemia that occurs as a result of aerobic training.
I can't see any more question in the chat box. Can I ask one question, Dr. Devamalar again? Why do we need some rest? You said we need some rest in between the resistance exercise.
Yeah. Okay. Normally, when we do resistance training, we do it. If you were to do it, ideally, you'll do it at intervals of 2 minutes. That means between each sets, you'll do 2 minutes. Okay, and this is to avoid muscle fatigue. But during these periods when we are fasting, and remember I said that resistance training can also be done during the day hours. So it's a good idea to prevent muscle fatigue. That's why we space out the resistance training.
Okay, thank you for explaining.
Thank you very much, Dr. Deva. Perhaps, Dr. Shakur, if I may, we move on to, there's no questions in the chat box yet. However, perhaps I could ask Dr. Jamila. I'm actually curious to know, how does the different themes that you presented to us help us in managing the patients that you have, that we have in the clinic?
Okay, thank you, Dr. Rohana. When we understand our patients and that is their perspective, definitely that number one, we could not make an assumptions to everyone, but at least these empirical evidences can help us to prepare that what kind of patients that we are dealing with. Yeah, and the way we ask open-ended questions or probably sometimes close-ended questions that we want to ask our patients could be tailored based on this theme and ask them to reflect on it. So in other words, that I would like to suggest that all of us to learn what we call motivational interviewing, as I think Dr. Aslina has mentioned, in order for us to utilize all of these themes and bring it to our clinic when we are doing interview or reflections and summarizing information with our clients.
Right. Okay. So actually, that was very, very interesting, and perhaps that could be actually incorporated in the Ramadan education programs. For example, the DEAR program that Dr. Suzyani is developing. We still don't have a question. We have one question. Perhaps before we answer the next question, maybe I would like to ask the next speaker, Prof. Nur Laila. You mentioned the necessity, so it's not a luxury, it's a necessity to actually perform the whole blood glucose monitoring. However, perhaps if a patient tells you that they can't afford it or they simply do not want to do it, which would be the most important reading that you would at least advise them to do?
Thank you, Prof. Rohana. I know it's always a challenge to ask patients to monitor blood glucose. I would say maybe after midday, because by then they've done some activities, blood sugar may come down further, and their last meal is during before dawn or during sahur. So that will give an idea whether they can sustain their fasting until sunset. So if let's say the blood sugar drop further, then they should break their fast before they actually collapse or become unconscious due to hypoglycemia. At least rather than they being admitted to the hospital, or if let's say they become dehydrated and they've been admitted with a HHS or DKA. So at least during that time, midday to the afternoon time.
Thank you very much. Dr. Shakur, we've got some questions in the chat box.
Yeah, I think there's one more question for Dr. Devamalar. I think there's quite a few. The first one was, can Tarawih prayer be considered as an exercise in Ramadan?
Okay, thank you for the question. Most definitely, because the the movements associated with these prayers itself, it's probably equal to about 15 to 20 minutes of doing light intensity exercise. So for those who do perform these prayers, in fact, you can consider them as part of your overall exercise program.
Thank you. The next one is for Dr. Devamandar again. If type 1 DM agrees, patient agrees to check regular sugars for exercise, will the time recommended be the same as you recommended or differ?
Okay, thank you, Mariana, for the question. Now, generally speaking, for type 1 diabetes, it's better that they do it in the fasted state, but any of those timings will apply to them as long as they can strictly monitor their blood glucose before exercise as well as after exercise for a few hours after exercise.
There's another question for Dr. Jamila. How to overcome with binge eating in Ramadan in diabetic patient and the role of the dietitian?
Okay, the easiest answer is to learn on how to conduct mindful eating and teach our patients to eat mindfully. But if you are interested to learn a bit more about psychology, you probably can learn about cognitive behavior therapy, whereby in cognitive behavior therapy, we do understand the distorted thoughts or patterns of thinking that leads to binge eating. But if you think that this is a severe binge eating, probably you need to talk to a medical doctor and need to do an assessment on eating disorders. If they have eating disorders, the best people for us to refer to is psychiatrists and also clinical psychologists.
Thank you, Dr. Jamila.
Dr. Shakur, there's no more questions in the chat, and it's already 7. But just if you can just allow me one question to Dr. Suzyani, I'm just curious to know: do you have patients who actually refuse Ramadan education, even if you want to offer them?
I've not come across that. I think our problem was more trying to get them to go for the tele-education last year, where it was not something that's more common. But subsequently, because we're doing teleconsultation for quite a number of our regular patients as well, so it's becoming something that's quite commonplace. It's not too much of an issue. Besides, with tele-education, we actually incorporate a psychologist and social worker in our team as well, based on the earlier study locally, which showed which Dr. Shakur and Dr. Lam were actually involved in, which actually showed that there are issues with coping and some concerns about psychological factors during those periods. So so we have actually incorporated those into our day program as well.
Thank you very much. You have to work on Malaysians. They think they know everything already, I presume so. Anyway, thank you so much to all the panels of speakers. Thank you to the organizers for the invitation to moderate the session. I enjoyed it immensely. And thank you, Dr. Shakur, for being my partner today. Over to you.
Okay, thank you, Dr. Rohana. Thank you all for all speakers and the participants. It was quite very interesting session. Thank you all.